Hello, everyone, and welcome to the session on Healthcare Advocates, the Hidden Hero. This is just one session of many that will be held by the Healthcare Advocate Summit prior to the hybrid live event that's being held in Galveston, Texas on September 8th through the 10th at the San Luis Resort. Just so you know, there are 61 days left for this inaugural event. So time is running out, space is limited. So now is the time to make sure you get registered for the event. Also make sure that you're getting your hotel rooms, just to make sure that we are, all of you guys have the opportunity to join us for this amazing conference. So just a good thing that's going on right now with NAMAPA is we're currently doing a giveaway offer to attend the 2021 Healthcare Advocate Summit. The winner of this giveaway will receive one free entrance pass and free lodging up to a $5,000 value with the San Luis. So check out our link in our comments to learn how to be entered in on the giveaway that will be added on shortly. So for right now, I'd like to introduce you to Anthony Werner. He's the CEO of Patient Advocate International. And we are here to have an in-depth conversation on how healthcare advocates can bridge the gap between patients and physicians and how their impact is enhanced during difficult times. So welcome, Anthony. How are you today?
I'm very good, thank you. Thank you for the time and opportunity to speak with you.
Absolutely, absolutely. Thank you for joining us. We appreciate it. So if you could, please just kind of give us a little bit of background about you, your position in healthcare, what exactly you do.
So my name is Anthony Michael Werner. Tony is as a native New Yorker, is what I go by. I'm the Chief Executive Officer and Chief Patient Advocate of Patient Advocate International. I help people of all different situations with benefits, authorizations, medical coverage, billing, advocacy and getting their medications, understanding medical treatments, pretty much guiding anyone who feels, as far as the healthcare, lost or not understanding. I'm pretty much walked them through the whole process from what I like to call the 3 Ps: payer, provider, and being the patient, letting them know that they're not alone in the system.
So Anthony, tell me, so what demographics do you cover? Do you cover just certain areas, or you help any patient anywhere?
I handle every state, a lot in the United States. I've also helped people within rare diseases in other countries work to get visas to get medical treatment in the United States. So any case that I feel I can make an impact or I can guide the system along is where I cover. So I don't have any geographical area. It is primarily the United States, but I have gone outside the country as well to help people. We're humanity, so there's no bound.
That's great. Absolutely. That's a wonderful just opportunity for you to help others. So I'm sure everybody appreciates it. And as a advocate myself, I definitely appreciate it. So can you tell me just what do you think about healthcare, the future of healthcare? Like, what is your opinion? Are you a little worried about it? Kind of give us a little bit of understanding what your thoughts are.
So I'm cautiously optimistic for many reasons. I think the pandemic has taught us a lot of things. The pandemic has taught us not only to respect and appreciate our healthcare workers of all disciplines, payer, provider, and facilities, but also understand that with the lessons learned, that we need to also understand we need to be resilient, which we were in this pandemic. We've managed to handle raw emotion, despair, and we've had all the emotions that anybody would have during a major healthcare crisis. And I think we also understand that the need to bond together as humanity. I truly feel that that's a lesson of why I'm cautiously optimistic. If we educate and empower and collaborate, which is the core mantra of not only patient advocacy, but everyone, payer, provider, and patient, we're gonna navigate anything well, any opportunity or any, I like to say opportunity. Well, the pandemic has taught us we can work as humans and come to a common goal of getting people healthy, dealing with families, and taking the burden off the system that we need to as advocates.
I absolutely agree with you. I think this pandemic has really shown anybody in healthcare just how resilient we are and the needs that our patients need and just the communities in general. So, how would you compare healthcare in the U.S. to other countries around the world? Do you think we are progressing in comparison to other countries? What are your thoughts?
To me, when I look at healthcare, I don't like to make the comparison with anyone else because everyone is unique in their own nature. For instance, processes for getting drugs approval and clinical studies everywhere and every healthcare system is different. And to compare, it's like apples to oranges. I always say that. However, to answer your question, the United States has always been a beacon as a leader in the healthcare stage, whether it be teaching healthcare providers, innovation, pharmaceutical industries, medical devices, clinical research, and others in patient care. So we shouldn't compare, but I think the opportunity that we have as healthcare systems with different deliveries and fundamental understandings should be coming together and taking best practices and learning from them and vice versa. And that, as we all know in healthcare industry, we're close knit, even though we may be diverse in language, culture, ethnicity, even distance, we're still in a close knit community with a core focus of helping people and maintaining outcomes in public health.
Sure, I absolutely agree with you there too. I mean, it's healthcare in general, I think, is just a family in a sense, regardless of where you're from. So everybody understands that language. So, do you have any opinion on money in healthcare? Any specific positions that are under or overpaid? I know that that's always kind of a sensitive subject, especially as a healthcare advocate myself. But I mean, it can be across the board for anybody.
So I'm not going to walk delicately. I'm going to be as delicate as I can be. But I definitely feel, especially again, I'm going to use the pandemic, our frontline clinicians and healthcare first responders should be paid for their compensation with their duties, obligations, risk to themselves, their families, and patients. As we know, a lot of people had to quarantine away from their families during the pandemic, which causes a lot of mental stress and loneliness and is really taxing on families. However, the valuable lesson we learned is also salaries and compensation packages in a capitalistic society is dictated by change and by the market. So again, for me to say people get paid too much or too little is irrelevant. But what I do think is there is more opportunity in healthcare that equity within, as far as even patient advocates, with our contribution to healthcare is, I think, underfunded entirely. But as far as what people make, all the power to them, as long as they're making a positive health outlook in healthcare and positive impact, all the power to them. And you know what? Please help the people who are trying to help you as well.
Absolutely. Absolutely. I agree. So, what do you think about politics playing a role with taking care of patients, providing the best medication? There's a lot of different play in that. What do you think?
Like everything in life, I think people with the understanding they mean well. I believe there is a fundamental meaning of trying to do right, whether you're a public servant, whether you're any sort of one who works in the, I'd say, legal system or what have you. I think everybody has a meaning to do right. Unfortunately, public health policies are stalled and take an enormous amount of time to be drafted and passed because of special interests, political grandstanding, self-interests. And we need to we're losing focus on the core values. Medicine and healthcare needs to be versatile and needs to be able to change on a minute's notice. That is the beauty with medicine. In my experience working in ER, I was watching something today, a doctor could give people terminal news or anybody, and the next case would be something totally different and you have to change. I think our government needs to be that versatile and agile to meet the needs of not only the people, but also the healthcare system in order to fundamentally make good legislation and be on top of the matter. But I don't think their heart's in the wrong place. I will say that.
And that's I understand what you're saying. Yeah. Okay. So, this is a big question. I know I've been asked this question before, but why did you choose to work in healthcare?
This is actually one of the more emotional questions for me. My father was a medic in Vietnam, and he won the Bronze Star he had served two tours. He won the Bronze Star for running across a minefield, taking two bulldog clamps since he worked in the OR. and cutting off the arteries and saving a guy's life. He came back, he worked for Blue Cross Blue Shield, and essentially he taught me at almost 9 ICD-10, CPT. My first book was Gray's Anatomy, and he was my hero. And my mother, who was terminally ill, she died when I was 21. She was only 45, had a brain tumor in 85, and she had kidney issues. And at 17, I learned to clean her nephrostomy tubes right in her kidneys and use sterile technique. And I really loved it. And my father, I'll never forget what my father said. He goes, "Tony, if you mess this up, you'll kill her." No pressure, Dad. Thank you very much. But it taught me the key fundamentals of medicine. And then I went to volunteer in the ambulance unit and work in the emergency room. And I love healthcare. I love helping people. I often say it's my fight with a higher being, because my job is to try to keep people on earth and keep people healthy. And unfortunately, I don't always win that battle.
Well, and it takes a special person to even work in healthcare and to understand the ins and the outs and to have that compassion, that empathy for those patients. So I applaud you. I thank your dad for his service. So, thank you for doing everything that you do now.
And likewise.
So thank you. So how do you feel like healthcare is being portrayed now, and how do you think it should be portrayed?
Healthcare is being portrayed as solely a caste system where the affluent get better healthcare than others, meaning healthcare providers, facilities, and payers all get a bad rap. I don't think it's right. I think partly is there changes to be made. Of course, are there good and bad actors in the healthcare field? Absolutely. But every one of my interactions with people have always been meaning to do good, whether it's the payer, and I know health insurance plans get a lot of flack. They're not bad. People try to do the right thing. I noticed the colleagues I've worked with, healthcare providers and healthcare facilities, their goal is to be able to feed their families, but also help people. And that's in business today, that's a really rough complement to understand both business and healthcare. And that's why I think patient advocates are really essential, because what we try to do is reduce the administrative costs and we try to create efficiencies. And I really think that once people understand with the 3 Ps, patient, provider, and payer, along with patient advocates, the 4th P in the equation, if we work together and complement, we will make significant changes to the healthcare system. And again, with bigger incomes, with bigger outcomes with public health and health outcomes, they don't realize we directly affect that.
Yeah, I can agree with you totally on that. And something that's important even to me is for patients to even understand that we honestly are trying to do the best that we possibly can. And, we look at costs even on a healthcare level when it comes to, us providing care for those patients. Those costs are looked at too, and we get it. We understand it. So, and it's definitely just a challenging environment to even try to navigate, and especially as a patient. And that's where we come into play. So.
And I think one of the biggest things is, with a lot of facilities, you always can't get people after hours on weekends. I know you and I have probably worked all hours of the day and night. I know I'd get calls at 2 or 3 in the morning on my daughter's birthday. So to me, I think that's really important, is that we're accessible when certain aspects of the healthcare system are not.
Right. And we need to be, and when there's times where we, a patient needs to talk to you at 6:30 at night, well, I'm talking to that patient at 6:30 at night. If we need to talk to a patient on a Saturday morning, that's what we're doing. We're trying to adjust to make sure that we're taking care of them. So it's definitely a little give and take in terms of making sure that we're taking care of our patients and we're also maintaining our lives as well. So in your opinion, then, what is the most important role in healthcare and why?
This is a loaded question. It's actually the patient advocate. I can honestly tell you, working in clinical, non-clinical, administrative, payer, the reason I think that healthcare advocates are so important is because we have the knowledge of each individual discipline and segment in the healthcare system to work with the payers, to give them the language they need, to speak to providers, give them the language they need, to speak to patients and give them the language they need. It's almost like a country that speaks 3 different dialects of a language, and we understand and we have the knowledge to speak to all of them. And that's one of the things I think is so key, is because I hear, like I'm dealing with a case now where the mother isn't actually a pediatric RN, sweetest lady in the world, trying to fight to get the care for her family. But the problem is, you would think as a healthcare provider, she knows all the different languages. And what we bring to the table is the education. Every patient I touch gets extensive education on the system, on the process, what's going on. So even if we lose, they're understood, or even if we're not able to get them what they need, they understand the options available to them, and they also understand why. And I think that is the biggest misconception in the healthcare system currently.
Yeah, and I get it and I understand it. And as a patient advocate myself and my whole team, we wear many hats, and we're going through all different kinds of scenarios, options, and when there are questions that are being posed on what to do for next steps, it comes to us, and then we're having to try to break down what's the best route, what's the best way to do this. So I agree completely. Not trying to be biased, but I do agree completely. So
We are the most agile, and we are the most collaborative facets in healthcare. And I don't mean that to detract from anyone else, but we're the conduit of everybody.
hmm yeah, we're working in between billing, nursing, providers, insurance companies. We're doing it all. You know what I mean? I mean, you have to be able to have that I guess that language and finesse, so to speak, to be able to work with each one individually and have you're going to have your own kind of language, so to speak, with each one as well. So I get it. I completely get it. Yep. So, what do you wish everyone would at least know? What do you want everybody to know about healthcare? What are your thoughts on that?
I can honestly say healthcare equity is a big thing, and we're learning more and more about healthcare equity along lines. I can tell you is seeing the news today and seeing just the horror and everything in the news and the dysfunction, and that seems to be what's on a lot. What I can tell you is this. With my time working in clinical in the ER with a lot of great doctors and nurses and people came in, we didn't care anything about race, religion, sexual orientation. You bleed red. As a human race, we all bleed red. Um, and I think understanding them and their cultures and understanding how that complements to healthcare, we don't care who you are. There's no bias in healthcare. You're a patient. You bleed red like I do. You cry like I do. You get mad like I do. There is equity in healthcare. We're working to get better, but every healthcare worker, advocate, anyone is out for one thing, to help you. And we don't care anything about any of your personal beliefs. We're here to help you. We'll take anything into consideration, but we're here to help you. We want to help you. To me, I mean, I say in my family, people look at me as who I am, but half my family is all Spanish. My daughter's half Spanish. And to me, I love all cultures, religions, people. To me, it's important to understand you're not a person of color or race or creed or orientation. You're a person before anything. We're humanity. And that's what we need to get back as a society. The fall of the Roman Empire, as they say, was a breakdown of the family unit. What they don't understand is we're all family in one way or another.
Right. Yep. Yep. We're all the human race. And that's one thing that people need to understand. There's only one race. It's the human race.
I agree.
So for those that are in healthcare, what resources do you think these healthcare workers need and why?
I think healthcare, first of all, I think there needs to be more money in healthcare as far as getting to the clinicians, getting to the end users to get the patient experience. I think that is where we do need to invest. Not to digress, but I really do think that healthcare workers need the support, not only financial, but emotional. I know, Natalie, you've been on the other end of a phone call where you just wanted to break down. I know there's calls where I've been so angry and so I've almost wanted to tear. And we need that support because people in our families and people in the industry, out of the industry, don't understand. They think everything, we're just emotionless machines, and we're not. I think we need the resources of education. I think we also need collaboration again, but we also need resources to digress, to be able to take our step down and say, we're still human. We need to relax. I mean, there's days where I'm upset because I don't feel I've accomplished enough. or when we lose a patient, we didn't do enough to help that patient. And I can honestly tell you, no matter what you feel, real quick, first time I worked in the ER as a technician, I lost a patient. His family was right there. I went home and bawled. And even my family's like, why? It's nature. They didn't understand the impact of seeing something like that happen. And even as patient advocates, we invest in our patients, like some of the primary care and the long-term standing pediatrics with the relationships of our patients. It's traumatizing. It's heartbreaking. We get up every day and we do it. But I think that's the thing people need to understand. And now with the post-pandemic, appreciate the healthcare workers. It's a big taxing toll. Even patient advocates, we still deal with the pandemic and the aftermath.
Absolutely. And even though we're, even with pandemic aside, trying to help these patients and getting them their life-saving treatments, and then talking with them and sitting down with them, and that, hugs, tears, you name it, we've done it with them, and that's just who we are. We're there to help them. And if that means we're crying on each other's shoulders because we got them, a treatment that's going to save them tens of thousands of dollars, then that's what we're going to do. Even if it saves them $20, $20, we're going to be there to help them regardless. And every single one of them is going to hit you in a certain way. And I can guarantee you, even now to this day, there's patients that I'm like, I wonder how they're doing, and I hope they're doing well, and they kind of graduate out of your needs, so to speak. But, it's always, we're human, and we're constantly thinking about what we could have done better, or if we could have done something better. I get it. Yeah.
And I think with the politics and everything in play, I think the money also needs to be given to health. And I'm not just saying this. We've had the offline discussions on this as well. Patient advocates need to be reimbursed for their services. How many times have you seen a patient who goes, I've lost my house, I've lost everything, and they can't pay? And you do it because out of the goodness of your heart, but then you have to wonder where your next meal for your family is. I think one of the biggest things is, as providers, which we are, we may not treat patients, we educate, we collaborate, and we make things efficient and administratively easier for the patient, provider, and payer. And by doing that, we need to be funded. And I really think that's one of the things that our legislator and healthcare system has dropped the ball on. And that's the only critique I will say negatively, because as a healthcare advocate, I didn't do it to become rich. I did it for the love of people.
Yeah, you definitely don't do it to become rich. You're absolutely correct on that. That's for sure. But we're there for the people, and we're there to for the patient and for our community. So that's the most important. So I'll just kind of move on to the next question. So how would you describe a healthcare advocate? I know there's a lot of terms, a lot of titles that are floating around in healthcare across the country as to what a healthcare advocate is. What is it to you?
I would say jack of all trades. I wouldn't say master of none, because I don't really feel that's entire. I think what we do is wear many hats. We not only work, so for instance, I do billing issues, I do prior authorizations, I help people coordinate care. I let them know about the different cares. I let them know about different, I present the whole facts to them. And as healthcare advocates, I feel that's what we do. And I feel it's such an unsung, unappreciated, and I don't mean that negatively, because people don't understand it, they don't appreciate it in its full context. So I get 10 times, how many times do you get a patient call as well as I do? So what do you do? What exactly do you do? What value do you bring to me? And half the conversation is intake of what the situation is, and half of it's basically understanding what I do and giving them the understanding of what the plan of action is. So again, it's education, it's collaboration, but what I also do is take a full history and physical. I take a complete medical record or documentation like you do, because we need to know not only the medical, but social, economic, everything to be able to help that patient. Insurance, secondary coverage. That's where I think healthcare, as far as healthcare advocates do. I couldn't sum it up in one sentence. I honestly, we could spend hours talking about it, because we don't get the same case twice. We're not subspecialists.
No, everything's different.
Yeah, we're not gastroenterologists. We're not surgeons. We get different things every day. And it's like, okay, I didn't expect that.
Right, right. Everything is different in healthcare. No day is going to be the same. No workflow is going to be the same. Everything's always going to be different.
And what I love about the Healthcare Summit, it's everybody coming together and speaking together and collaborating and educating and making those connections so we can address public health and outcomes together. And I'm really excited to do this. Again, public speaking, I get nervous, but honestly, I feel comfortable talking to you, and I'm looking forward to speaking because I want to get the message out there. And we can speak to you about a case, or I can speak to anyone of your colleagues, Melissa, Liz, and I feel that is number one important is we also need a sounding board of, hey, does this make sense to you? What's your experience?
Exactly. Exactly. And it's, having that networking team of, working with others across the country. We've all seen it, and but how everybody's reacted differently to it. So what did you do, and what did you do? And it's really good to be able to kind of bounce those ideas off others to kind of maybe even just get a different idea or opinion or something to make it work better.
Exactly. And I've learned a lot from you guys already. So the collaboration has definitely been a great collaboration. And
It's a combination, and we're just a small group of hundreds of thousands. We're just a small group. So it's, just, can you even imagine just being able to bring all of these people all into one place to be able to bounce these ideas off others? It's great. I'm loving it and cannot wait. So, I just have a few more questions for you. I'm going to roll through them, and then we'll kind of move on.
Yeah.
So what would you personally change in healthcare, and why?
Equity. I've learned a lot. So being in healthcare, and I'm not going to go too far into dates or ages, but about 25 years, I've learned equity is very important. Education and collaboration are the three biggest keys. And what I mean equity, it's not looking at certain demographics differently. It's speaking to that demographic so they can understand, so you can get them the care they need. I think equity, as far as even people who are unemployed, not understanding the potential, and even with the healthcare market, understanding the type of plans. I've had patients too where they're like, hey, listen, I never got a Medicare plan. I don't know what drugs are covered or what not. I'm afraid of losing it. And how many times have we had that conversation? So equity goes a long way, and it's just not based on demographics. It's based on a lot of different factors that we need to look at.
Sure. Yeah, I understand and get it completely. I get it. Everything that you're saying, it's like you're preaching to the choir here, just because we're on that same page. So I understand completely, and appreciate your thoughts when you're talking about each of these subjects, because others need to hear it too. So even if they've never heard of it, it's always good to know. So what would you consider the number one focus then in healthcare?
I honestly say with the number one focus is to be able to socialize medicine is not something I'm advocating. I think it has its benefits and its pluses. I love the system that we have could be hybrid, but I do think that a lot of people don't get the adequate care for many reasons. I think the number one focus is to getting healthcare and getting The healthcare system is strained. Hospitals are spending tremendous amounts of money. Managed care companies are spending tremendous amount of money. Pharma is spending tremendous amounts of money. And I think it could be better used for healthcare advocates to get people understanding and treated effectively and getting them to understand. I think we bring such a focus to the table that we are currently undeserved, and we are not well looked at as far as getting the financial acumen that we need to be able to do the missions that we need. I think if the whole healthcare system as well put money into us, I firmly believe, and I'm not just saying that because I'm a healthcare advocate. I played many roles. I think it's going to be the best thing for the system. And you will see healthcare outcomes and administrative costs across the board, and this is the MBA speaking, dramatically drop. It's going to be an inverse relationship. Costs and patient satisfaction, costs are going to go down, patient satisfaction and engagement. And as far as patient's outcome, it's going to be better. What happened is we had high deductible plans, which are CDH, consumer-driven healthcare. How can you have a consumer-driven healthcare when you have an uneducated consumer base? They don't know the difference between an MRI or a CAT scan. They don't know the difference why they're having that test. They don't know the difference between biologics, Enbrel, Humira. They don't understand. And one of the biggest things I'm definitely going to speak to at the conference is education and collaboration. You can't have a healthcare system where it's not buying a TV or buying a car where you can go to Consumer Reports. That's the focus, and that's what I think we need to do in healthcare. Once that is embraced, patient advocacy, independency, people are going to realize that it's a money well spent 10 times over, and don't push the cost to the patient.
Yeah, that's a good thought. Good, definitely good opinion on the whole cost of everything, because you're in a different aspect than I am. I'm kind of just basic patient advocate here, and you kind of look at it and you see it as at that bigger picture, and not everybody sees it that way. So I appreciate your input on that. So what do you think is next with innovation in healthcare?
As far as scientific innovation, I think we've done tremendously and a lot of people may be skeptical about the vaccine, but let's look at the fact. Jonas Salk and the polio vaccine was the last vaccine discovered. Now, we've created a vaccine and dropped dramatically in cases of COVID-19. And I'm not a conspiracy theorist. People can have the right to think what they want, and I respect that. But we were able to come up with a vaccine, get it preliminary tested, be able to use different technologies to cure pandemic. I truly think that innovation has three different facets. It's number one, obviously, technology. Again, innovation is making the healthcare system better and more adaptable, again, with the equity and again, with the engagement. And last, I think innovation needs to happen with basically data integrity. I think data integrity and cost are a big thing. We spend so much, a lot of tech guys are coming out with beautiful data, beautiful tools in healthcare. The question is, how can we leverage them to even patient engagement, and even so far as patient advocacy is another key thing. So innovation doesn't have to always be scientific. It comes across many different disciplines. And I think that's something we need to look at. We're the pioneer of pharma, we're the pioneer of medical devices, as far as everything. The question I have is this: what other areas, as far as patient engagement and also, again, data integrity, do we have in part of delivering and making the healthcare system what it needs to be today?
So then, last question. What's the first thing that comes to mind when you hear Healthcare Advocate Summit, an event created by advocates for advocates?
It's about time. It's about time.
Right? Right? How many conferences have you gone to and there's a small focus on any kind of healthcare advocacy and everything else is focused on pharma? Like, just think about it. Really think about it.
I know. And I'm going to tell you one thing real quick. My first patient, 9-year-old little girl, terminal brain cancer. Very quickly, I saw her mother on Facebook crying, and I called up and I said, "What's the matter?" And she needed help getting the medication for compassionate use. Long story short, we got it approved. She passed on Christmas. And I said, "You know what? This is my calling." I said, "I'm not going to be a millionaire. I know this. Oh, I know this. But you know what? What I can do at night is sleep. Sleep knowing I did the best thing I can do." And you know what? Healthcare advocates, it's about time. And again, public speaking is not my forte, but I cannot wait to speak to you guys and engage. And I really speak to anybody who I'm like, if you don't go, you're missing. I mean, this is not just a conference where, expensive dinners or this. It's people getting together, sharing ideas to improve the healthcare system. That's what we do. That's our focus. It's about damn time, excuse the French, about time. And you know what? I really want you guys to do more of these sessions. I love the fact that, I'd love to see people engage. People can always reach out and call me on LinkedIn or Facebook. Again, we talk a lot, and I really love the engagement. It's about time. And I really hope you have many more. And I really hope it's supported within the healthcare industry to say, you know what? We need more stuff like this. These are the people that are run the front lines with us and help us. So, amen. Not religiously, but amen.
Absolutely. Absolutely. And just it's, you kind of think, and even when I started this position, I didn't know of anybody else who did this. I had no idea, didn't even know how to find these people. And started in one conference and slowly started realizing that there's not a lot of information out there for advocates. Like, I want to learn certain things. I want to meet others that are like me. And there's nothing out there that's really available. And so with the Healthcare Advocate Summit, this is bringing us all together. And so now we'll be able to have this large network to be able to talk to somebody who has same issues with an insurance company, or we're having barriers trying to get free drug, or whatever the situations are. What have you done? So this is a first for me, and I am excited. I can't wait. Like you said, it's about time.
It's a springboard into where we need to be, and it's a springboard to get everyone understanding the benefits and the needs for patient advocates. It's really the beginning of an evolution in healthcare that if people embrace and really embrace and take a hold of and advocate for us as we advocate for them, it will be something that the healthcare community will not regret, nor will people in politics or anything else. I'm really looking forward to it.
And it'd be nice to kind of be on that same level as others within the healthcare system, such as social workers and whatnot. I mean, the work that we do across the board is just as important. So
we bring something called transparency.
Mm-hmm.
That's a big word today. Transparency.
Yeah.
Not that there's not been, but we improve the transparency within all areas of healthcare. That's what we bring to a table.
Right. Absolutely. I agree. So this actually that was the last question. Anthony, you did really well. You were so worried about public speaking and you flew right through it. So thank you, Anthony, for participating in today's live event. And if anybody that is joined watching is going to watch later, would like to meet Anthony or any of our other speakers that are going to be participating at the Healthcare Advocate Summit, please join us for our hybrid event on September 8th through the 10th in Galveston, Texas. I just want to give a final little shout out to all of our sponsors for supporting the Healthcare Advocate Summit. We greatly appreciate you wanting to move this forward and wanting to participate and seeing the need and understanding the importance of healthcare advocates. So thank you very much to the sponsors. Also, personally, I would like to thank all of the healthcare facilities. 71 healthcare facilities across 40 states are participating, whether they are sending any kind of leadership or patient advocates to this event. This is so important for all of these patient advocates and needing to be a part of this process and networking and learning and just kind of understanding a little bit different parts of the systems and how things are working. I personally, I appreciate the healthcare facilities wanting to be involved in this as well. So thank you to everybody.
I agree. Thank you very much to not only the sponsors, to everybody, yourself, and thank you for the people viewing. We really appreciate the support.
Absolutely. I agree. Thank you very much. So that is the end of our role of our hidden hero. Here's our Anthony, our hidden hero, who knew Anthony existed until now, our hidden hero. So I appreciate you and all the work that you do. And until next time, I would like to just say, have a great day, this beautiful weather, wherever you are. And we're seeing everybody in Galveston, Texas on September 8th through the 10th. Have a good day, everybody.
Thank you. Be healthy, everybody.